New Jersey's hospitals are seeing a scary trend. 1/3 of nurses have dropped out of the field completely since 2019. Now, it's easy to blame the pandemic, but those on the inside say it's actually about burnout, that nurses are simply expected to do too much and care for too many patients than what's possible or safe. Yesterday, nurses and healthcare workers rallied in front of the State House, calling on the legislature to finally pass a bill that would require hospitals to increase their staffing. Melissa Rose Cooper was there to hear their demands that they say are a matter of life and death for their patients.
We can't afford to wait any longer. We must demand a voice for safe staffing.
So these nurses and healthcare workers are calling on the states to help ease what they say is an ongoing crisis, a severe staffing shortage in the healthcare system. They want lawmakers to pass legislation that will mandate nurse-to-patient ratios in hospitals.
I'm not just talking about this nursing shortage, this nursing mandate. I've lived it and still living it. The problem is that this would solve the nursing shortage if we had a state-mandated nurse-patient ratio.
A bill being reviewed in the Senate would enforce a nurse-to-patient ratio in hospitals.
Now more than ever, we need to pass this bill to stop the exodus from our hospitals of dedicated, courageous nurses and other healthcare workers.
According to a new report from New Jersey's largest healthcare workers union, health professionals and allied employees, staffing shortages create extreme burnout on the job, forcing more and more frontline workers to leave the field.
30% have left the bedside. Of those who remain, 72% want to leave. Of those who have 0 to 5 years experience, 95% want to leave.
Healthcare workers say they've been dealing with the staffing shortage for far too long, and not only is it stressing them out, but it's also putting the patients at risk.
Short staffing results in increased patient mortality, unable to accurately provide the care that's necessary, lowers patient satisfaction, and lowers nurses' job satisfaction, longer length of stays.
But not everyone agrees having a mandated ratio is the answer. According to the New Jersey Hospital Association, who say enforcing this measure wouldn't be in patients' best interests. The president and CEO saying in a statement, the last 3 years have taught us that nurses and teams of other experienced healthcare professionals need flexibility to use their clinical expertise to make the best decisions for their patients. Determining adequate nurse staffing is complex. It changes on a shift-by-shift basis and is based on patient acuity and turnover, availability of support staff and skill mix, and the setting of care. In 2020, Governor Murphy signed into law a similar measure for long-term care facilities. However, some LTC industry advocates say the staffing ratio is actually hurting patient care by forcing nursing homes to hire and retain any CNA they can find without regard to quality, while inflating costs.
That's definitely a challenge for healthcare facilities right now, and I know that they are working as best as they can to make sure that staffing is adequate. I think mandates become a challenge for them when they're already facing these staff shortages, and that would be something that might be difficult for them to implement in practice. But I know that it is a top priority for all of our healthcare facilities across the street to really make sure that we're attracting and retaining more people into the field without any mandates right now.
Enforceable standards affect retention of nurses in hospital bedside jobs. Enforceable staffing standards make the work environment safer for both patients and healthcare workers. Enforceable staffing standards benefit hospitals by saving them money. Don't believe for a second that it'll cost them more money. It'll save money.
A bill calling for mandated nurse-to-patient ratio is also being considered in the Assembly. Advocates are planning another rally for May to get lawmakers to push the legislation through. For NJ Spotlight News, I'm Melissa Rose Cooper.
In our Spotlight on